This question is from Carol. She said she works with hospice patients, and they usually kept supine with head raised, pillows everywhere to prevent pressure points. My biggest issue is my back. I'm leaning over a hospital bed, and I end up not being able to stand correctly. Any ideas how to massage correctly a patient in a hospital type environment who cannot move? Thanks. I myself, when I massaged clients in nursing homes, what I would do is, it's called a draw sheet or turning sheet, some people call it. It's like a third of the size of a regular sheet, and it's a lot thicker. Some people even call it a bath blanket. But what you do is you have it the lengthways, and you make sure you roll it underneath the client, and make sure the shoulder and their hips are both on that. So you put that sheet all the way underneath of them. So it's laying, so let's say this is the bed here, this is their head here. You put the sheet like this. And what you're going to do is you're going to crinkle it up like this on one side, and then you can just give a little pull a little bit each time so you can bring the client towards you. And if anybody has ever worked as a nursing assistant, that's what people do, is they have a turning sheet so they could turn the clients then. So that's a nice way to bring the clients toward you. Or if you're working in a hospital in those kind of settings, just put the call light on and have the nursing assistant or the nurses help turn or help position the client then. But just make sure, let's say they're really close to the edge of the bed. So let's say this bed is here, they're really close to over here. Make sure you're on this side so they feel comfortable at all times, so they don't feel like they're going to fall at all. And so that's my suggestions with that. So again, a turning sheet or draw sheet, some people call it, and it's a bath blanket, and make sure the shoulders and the hips are definitely underneath of it. But what you have to do is you gotta kind of roll it underneath of them and kind of squish it underneath like this, and make sure it's even on both sides, so it's on lengthwise like this. And then the side that you want them to move towards, you scrunch it up and just give a little pull, but just make sure your legs are against the bed so the bed doesn't roll, because sometimes with the bed the wheels are not locked, so you just don't want to pull everything then. But if in doubt, I think it would be a lot better if there's a nursing assistant or nurse or a personal care attendant around there. Have them do all the turning work for you, because that's what they're trained in. So it's a little bit above our scope of practice, but again, it all depends. Okay, and anybody else has dealt with patients in hospitals, hospice, those kind of things, leave your comments below. Thank you. Say hi. Say hi. Are you shy today? Huh? Say goodbye.